During a routine exam, it really is pretty simple. We start from the front and work our way back. Starting at the front, we start with the eyeglasses, checking the prescription. From there, we look at the tear film. The tear film is what can cause a lot of visual complaints, whether it be discomfort or blurred vision. The tear film is just like the windshield on a car. If it's not clear and if it's not smooth, you're not going to have good vision. Then we work to the front of the eye, meaning the color part, the iris. Looking right behind the color part of the eye, we have a lens about the size of an aspirin. That lens is what we use to focus with, and that lens eventually becomes cloudy. That's what we call a cataract. Everybody eventually gets a cataract. You can be born with the cataract, certain medications, trauma, but typical is time. So you take a patient age 65 or 70 and over, you're going to find a cataract in their eye. Again, they're still going to be able to function with that cataract, maybe needing a slight change in prescription. Next, we're looking at the back of the eye. We're looking at the central vision, the macula, an area maybe the size of a pinhead, but that's an area that will degenerate and cause a loss of vision. We look at the optic nerve. The optic nerve travels from the back of the eye to the back of your brain. So any change throughout that course can affect the optic nerve. Things like multiple sclerosis, even brain tumors can show up in the eye. We also get a good look at the blood vessels, anything that affects the vascular system. Blood pressure, diabetes, leukemia, AIDS, any of these conditions can show up and manifest in the back of the eye. Lastly, we look at the periphery of the eye, the way out up to the edge of the retina, looking for changes in retina, maybe a detachment, maybe a tear, maybe a hole. It truly gives us an entire look at the eye.